Many countries in the European Union struggle to approve new health technologies, such as medicines and medical devices, leading to inequalities in access. Depending on where a patient lives, it takes an average of more than a year to get the treatment they need. This is often due to issues around pricing, affordability and differences in the value assessment, and that's where ASCERTAIN comes into play. ASCERTAIN is an EU-funded project that started in 2022 and it stands for affordability and sustainability improvements through new pricing, cost-effectiveness and reimbursement models to appraise innovative health technologies. It is a project with a big name and an important mission. Let's dive in and learn more. With our project, we want to explore ways and methods of making health technologies more affordable and accessible for different stakeholders, whilst at the same time encouraging and rewarding innovation. We also believe in considering the environmental impact of health technologies. If the health sector were a country, it will be the 5th largest emitter on the planet after China, the USA, India and Russia. We want to identify and promote greener production methods. Make sure that the entire life cycle of a health technology is considered. So how do we achieve these goals? ASCERTAIN is developing a special tool called the Access to Meds Policy Support Tool. This tool will be online and available to anyone. It provides models and tools on pricing, cost effectiveness and reimbursement that consider country-specific conditions and help decision makers to understand how much technology should cost and how they can make them accessible to their population. The ASCERTAIN project is more than about creating the tool. We want to make sure it meets the needs of patients, industry, policymakers and payers. That's why we are working together with a diverse group of partners and an international advisory board. ASCERTAIN believes in transparency and open access. And that's why all the tools and models we develop will be hosted on a publicly accessible platform following open science principles. This way, many can benefit from the knowledge and information we provide, and it's important to understand the needs of all stakeholders. Let's find out.
As a patient, I need my treatment as fast as possible. I don't want my condition to get any worse.
As a doctor, I want to give patients the best healthcare option that exists.
As a payer, I have to consider the budgets and reimbursement as well.
As an industry member, I need to define a price that gives sufficient return of investments.
As a researcher, I need access to data, and therefore open access tools are of great value for my work.
With ASCERTAIN, we can create a more affordable and accessible healthcare system by considering the environmental impact of health technologies' entire life cycle. Stay tuned for more updates on our journey.